Austin Davis. I'm a nurse practitioner student at Henderson State, and today we're going to be doing HEENT exam. That stands for head, eyes, ears, nose, and throat. Do you have any questions?
No.
Okay, so I'm going to start by doing some hand hygiene and getting some vital signs. While I'm doing this, do you have any issues with your head, eyes, ears, nose, and throat?
I have seasonal allergies.
Okay, tell me a little bit more about that. Like, what time of year affects you most?
Well, usually in the fall.
The fall?
There must be some plant that I'm allergic to that sets off my asthma, so I have to use my inhaler
Okay.
around that time, mainly whenever I go to bed at night.
When you go to bed, how often do you use it? Like, do you 2 puffs, like before bed, or?
Yes, that usually is sufficient.
What medication is in your inhaler? Do you know? Is it albuterol or an Advair or?
It is albuterol.
Albuterol. Okay.
Yes.
Do you take anything daily for your allergies, or?
Yes, I do. I take Claritin daily.
Daily, every morning.
Yes, 10 milligrams, I believe.
Okay. Well, we're going to start with the exam. So first, I'm going to start by palpating, which just means I'm going to be touching. So I'm going to start at the back of your head and kind of work my way forward, and then we're going to palpate your sinuses after that. Okay.
Okay.
So we're just going to start. I'm feeling for any masses, lumps, anything like that. Any depressions. I'm palpating the sinuses. Any pain, tenderness when I do that?
No.
While I'm doing that, I'm also inspecting, just making sure I don't see anything. So next we're going to move on to the eyes. So I'm going to take my pen light here and I'm going to have you follow my pen light with just your eyes. And then we're going to go, okay, I'm going to check your pupils for reactivity. Once more on that side. Okay. Now I'm going to use my ophthalmoscope. I'm actually going to look in and on the other side. Okay, so next we're going to move on to the ears. So I'm going to have you turn your head that way. I'm going to check this ear and then we'll switch sides. So first I'm going to look for anything. We're going to feel the doors back. Okay, now I'm going to look inside. I'm going to look at the tympanic membrane. So I'm going to pull the pen up and back. And at this point, I'd be using an otoscope. Okay, now let's do the other side. Same thing, I'm going to inspect. Pull it back, check behind. Pull the pen up and back. Perfect. And now we're going to do a hearing test. So I'm going to whisper something on this side and I need you to repeat it. And then we'll go to the other side.
Okay.
1, 2, 3.
1, 2, 3. A, B, C.
Perfect, okay. So now we'll move on to the nose. So first thing I'm gonna inspect, do you have any nasal tenderness, any drainage, anything like that?
No, I do not.
No, okay. So what you do is tilt your head back. I'm gonna look inside. Ever had your nose broken?
No.
Ever been told you had a deviated septum?
No, I have not.
Okay, perfect. Now if you bring your chin down, so we're gonna check your nasal patency. So what I want you to do is plug one side and breathe in and out, and then we'll do the other side. Okay. Perfect. Both sides are patent. Now we're going to move on to the mouth. So I'm looking at the mouth. There's lips appear to be moist. There's no cracking, any bleeding, anything like that. So now open your mouth for me. We're going to look at your teeth. I'm looking for any broken teeth, fillings, cavities, anything like that. And you have all your normal teeth, no dentures, partials, anything like that?
No dentures.
Okay, perfect. So what I'm going to do is have you open your mouth. Then I'm going to have you put your tongue to the roof. Perfect. I'm looking underneath. If you bring your chin down just a little bit. And now to the left. And then to the right. And now lift your tongue and I'm going to look underneath. You can bring your head towards me, please. Thanks. Okay. And now we're going to look at the back of your throat. So open as wide as you can. And I'm looking at her tonsils. They're both pink, moist. There's no redness, no drainage, no swelling. Her mucous membranes appear to be pink and moist. Gums appear to be pink and moist as well. And lastly, I'm going to palpate your lymph nodes. What I'm going to do is kind of run my fingers along the underside of your jaw, down your neck, and then kind of along your clavicle. Okay?
Okay.
And what I'm feeling is any pea-sized masses. I do not feel any. Perfect. Now I'm just going to inspect your neck. Your trachea appears to be midline. There's no JVD noted. And I think that pretty much concludes my assessment. Do you have any questions of me?
No, thank you.
Thank you.